Imagine being alone at home, suddenly feeling intense chest pain, as if something were about to explode inside you. There's no one around to help. What would you do in the next few seconds? Could you act quickly enough to save your life? Although it sounds like a movie plot. This situation is a bitter reality for thousands of elderly people living alone, facing the silent fear of a heart attack every day with no one to turn to. My name is Dr. Aina Laura. I've been a cardiologist for over 10 years and have treated countless patients with heart problems. Today, I want to talk to you candidly, as if we were face to face in my office. What I'm about to share could be the thin line between life and death. If a person suffers a heart attack alone, the chance of death is as high as 89%. But if you know what to do in the first 10 seconds, the chance of survival can exceed 90%. The difference: knowledge. Ignoring the signs can be fatal, but being prepared makes all the difference. That's why I want to share with you everything I've learned over decades in medicine, a learning that goes far beyond books, coming from experiences in emergency room corridors and the real stories of those who nearly lost their lives. Recently, I received a call at 3 in the morning. On the other end, a woman cried with emotion, "Doctor, it was a miracle. My father survived. Thank you for teaching me what to do." She was talking about Mr. Joel Santos, 78, who had a heart attack at home, completely alone. He managed to stay calm, followed the steps I had taught him months earlier, and arrived at the hospital in time. When I met Mr. Joel afterward, he said something I'll never forget. "Doctor, if I hadn't remembered what you explained, I wouldn't be here today. It wasn't luck, it was preparation, being ready to act when it mattered most." Today, I want to offer you that same chance. I'll teach you the 8 fundamental steps to surviving a heart attack when you're alone. I'll do it in a simple, direct, and human way, because this is knowledge you don't learn in college, but rather through practical experience, observing those who have faced death up close and managed to come back. Before we begin, I need you to understand something crucial. A heart attack rarely presents itself like in the movie, with screams and dramatic falls. The truth is, it's silent, confusing, and treacherous. On the day of Mr. Joel's heart attack, everything seemed normal. He woke up at 5 in the morning, made coffee, and sat down to read the newspaper. Suddenly, he felt a strange pressure in his chest, not a sharp pain, but an uncomfortable sensation, as if his heart were being crushed. He thought it might just be indigestion, but the discomfort only worsened. After half an hour, he began to feel tingling in his left arm and a dull ache in his jaw. It was at that moment that he realized this was a heart attack. This realization saved his life. If he had ignored the symptoms, attributing them to age or stress, he probably wouldn't be here to tell the story. The numbers are clear. 87% of people mistake heart attack symptoms for minor issues. The flu or muscle ache sand waste precious time. Every minute matters, as the heart is increasingly damaged without proper treatment. Now, pay close attention. People over 65 who live alone face a 4 times greater risk of dying from a heart attack compared to those who have company. This isn't because their hearts are more fragile, but because, when they're alone, they often don't know how to act or simply don't do anything. However, this reality may be different for you. Even alone, it's possible to prepare, learn what to do, and act at the crucial moment. Mr. Joel didn't survive by chance. He was prepared. Months earlier, he had attended a lecture where I explained in detail what to do if a heart attack occurred while alone. When the moment arrived, he didn't let himself panic. He looked at his watch, took a deep breath, and said to himself, "Okay, now I'm going to follow this step by step." That's the big difference between those who are prepared and those who are prepared remain calm, even in the worst-case scenario, because they know exactly what to do, how to do it, and in what order. Those who aren't become paralyzed, despair, and often make decisions that make the situation even worse. If you have high blood pressure, diabetes, high cholesterol, or are a smoker, your risk of a heart attack increases even further. But here's the key point. Even with these factors working against you, being prepared can ensure your survival, and not only that, it can minimize heart damage. Today, Mr. Joel is fully recovered. He's back, walking, reading, and enjoying the company of his grandchildren, all thanks to his preparation, and you can reach that point too. In the next step, I'll show you the 5 most important signs your body gives before a heart attack signals that can save your life if you recognize them in time. Most heart attacks don't happen suddenly. Your body warns you beforehand. I want you to remember this information, write it down, and share it with loved ones. If you ever experience these signs or notice them in someone close to you, you can act quickly enough to prevent a tragedy. First sign, a feeling of pressure, oppression, or heaviness in the center of the chest. It's not a sharp or burning pain, but rather an uncomfortable sensation, as if something heavy is crushing the heart, like a stone resting on the chest. Many patients describe it as feeling like someone is squeezing their heart from the inside. This discomfort lasts for more than 15 minutes and doesn't go away with common medications. Second sign, spreading pain. It starts in the chest, but can soon radiate to the left arm, sometimes both arms, the neck, jaw, or even the upper back. Jaw pain is particularly common in women. I've heard reports of patients mistaking this symptom for a dental problem and, instead of seeking emergency care, going to the dentist. Third sign, extreme fatigue for no apparent reason. If one day you feel exhausted without any effort, as if your body has no energy left, it could indicate that your heart isn't receiving enough oxygen. This sign is common, especially in women, and often goes unnoticed. But if it's accompanied by other symptoms, you should take immediate action. Fourth sign, sudden shortness of breath and cold sweat. You're resting, having climbed stairs, but suddenly you start having trouble breathing with a tight feeling in your chest, and a cold sweat covers your skin even if the room is cool or you're in front of a fan. This is one of the most worrying signs and is often mistaken for an anxiety attack. However, when it occurs along with chest pressure or pain radiating to other parts of the body, it's a clear sign that the heart is in distress. The fifth sign is dizziness, accompanied by nausea or even if you suddenly feel dizzy, as if you're about to faint, or start experiencing unexplained nausea, even vomiting, don't chalk it up to simple indigestion. Many people end up taking antacids or digestive medications, thinking the problem is in their stomach, when in fact, these symptoms can be the first signs of a heart attack. It's important to emphasize something fundamental. You don't need to present all 5 of these signs at once. 2 or 3 are enough to suspect something serious is happening. And if you have risk factors such as hypertension, diabetes, high cholesterol, or a history of smoking, just one sign is enough for you to take immediate action. Mr. Joel, the patient I mentioned earlier, identified 3 of these signs: chest pressure, radiating pain down his arm, and sudden fatigue. For him, this was enough to recognize the severity of the situation and act quickly, ensuring minimal damage to his heart. Today, he still walks every morning and enjoys the company of his grandchildren, a victory for preparation. I want you to achieve this same result. So now we come to the most important part of this video, the 8 essential steps you should follow if you're alone and notice the first signs of a heart attack. You don't need to be a doctor or have special equipment. What matters is calm, memory, and decisiveness. Even if you're far from a hospital, these steps can increase your chances of survival by up to 90%. So pay close attention, listen calmly, and, above all, practice these actions. Most of them can and should be practiced before any emergency occurs. We prepare for so many situations in life, but few take the time to prepare to survive a heart attack, and that's about to change today. Are you ready? Let's move on to step number 1. As soon as you start feeling symptoms, immediately stop everything you're doing and sit down in a safe place. Don't keep walking. Don't wait a few more minutes thinking it will pass. Stop. Find a chair or sofa with a backrest and support your back. Avoid sitting on the floor, as this can hinder circulation and worsen your condition. Also, avoid standing, as the priority is to ensure stability and prevent falls. Mr. Joel was about to go for his walk when he felt pressure on his chest. He sat on the bench in the hallway, supporting his back, and thanks to this, he didn't faint or lose consciousness. This simple first step can save lives. Step 2. Chew an aspirin. If you have aspirin at home, take a 100 milligrams tablet immediately. But don't swallow it whole, chew it thoroughly and let the medicine dissolve in your mouth. Why? Because chewing aspirin absorbs it much faster, helping to dissolve clots that may be blocking your artery. This simple measure can reduce heart damage by up to 40%. An example of this is Maria Silva, a 76-year-old woman who lives alone. One morning, she began to feel unwell. Despite her nervousness, she remembered the advice she received at a health lecture, chewed an aspirin, and called 911. Upon arrival at the hospital, doctors confirmed that thanks to this quick action, her heart suffered almost no damage. If you don't have aspirin at home, don't despair. Just proceed calmly to the next step. However, if you have a history of heart problems, it's essential to always keep a box on hand, preferably in a visible and easily accessible location, for example, on top of the refrigerator. Now, if you are allergic to aspirin or suffer from gastric ulcers, avoid taking it and go straight to the next step. Step 3. Call emergency services and provide your address clearly. Make sure you have the correct number for your area saved on your cell phone. Most importantly, provide your full address at the beginning of the call. This is because, during a heart attack, you could lose consciousness at any moment. And if you don't provide your location beforehand, it may take emergency responders a while to find you. An example of what to say when answering a call. My name is Matia Sousa. I'm at 23 Rua Atlantica, Jardins neighborhood. I'm having chest pain and difficulty breathing. After that, calmly answer the agent's questions. Don't hang up. Don't exaggerate details, but don't minimize the problem either. Speak clearly and objectively. Step 4. Unlock your front door and leave your key or gate code visible. This step is more important than it seems. If paramedics arrive and the door is locked, they'll waste precious minutes trying to get in. If your door has an electronic code, write the code on a large piece of paper and place it at the entrance where it's easy. If you use a key, leave it in a visible place, such as in a plant pot or on the doormat. Don't worry about the possibility of thieves at this point. Your life is worth much more than any object. Step 5. Adopt a position inclined at approximately 45 degrees, with your legs slightly elevated. Don't lie down completely, nor stand erect like a statue. Ideally, lean back in a chair or sofa, supporting your back at a 45-degree angle. If possible, elevate your legs slightly with a pillow or cushion. This position helps blood flow to the brain and heart without straining the lungs or circulatory system. Lying down completely can cause fluid to build up in the lungs, and being too upright makes the heart work harder. Step 6. Send a brief text message to your family. Avoid calling at this time. Talking on the phone is taxing and can worsen your condition. Send a short, direct message without unnecessary details. Something like, I'm experiencing heart attack symptoms. I've already called 911. They're taking me to the hospital. Don't worry. Come here. Don't send it to just one person. Send it to 2, 3, or more family members to ensure someone sees it if one doesn't respond. Step 7. Breathe deeply. Inhale through your nose for 4 seconds and exhale through your mouth for 6 seconds. This slow, controlled breathing reduces strain on your heart, helps you stay calm, and improves oxygen flow throughout your body. Do it like this: inhale through your nose, mentally counting to 4, and exhale slowly through your mouth, counting to 6. It's important to breathe from your abdomen, not just your chest. If you can, make a soft sound as you exhale to maintain rhythm and control. This technique not only relaxes but also improves circulation and helps you gain time. Step 8. Press firmly on the inside of your wrist and cough 3 times vigorously. It may sound strange, but this little-known technique can be crucial in an emergency. Use your thumb to press on your wrist, right where you feel the pulse, and simultaneously cough vigorously 3 times in a row. Why does this work? Coughing creates internal pressure in the chest that helps maintain blood flow, while pressure on the pulse helps regulate the heart rate. It's important to understand that this method isn't a substitute for medical care, but it can help stabilize your condition for a few precious minutes, and those minutes can decide between life and death. Mr. Joel applied all 8 steps precisely and without hesitation. 14 minutes after calling 911, the ambulance arrived. They found him conscious.com and in the correct position. Today, months later, his heart is functioning normally, and his story has already inspired others who watched the same video. Now, it's your turn. Learn these steps, write them down, stick them on the fridge, do whatever it takes to keep this information always accessible. So far, I've talked about what to do if you're alone and start experiencing heart attack symptoms. But there's something even more important: preparing yourself before it happens. Because no matter how well you know what to do, ideally you'll never need to use that knowledge. And that is entirely possible. During my career, I've met hundreds of people over 80 who have never had a heart attack. Do you know what they had in common? 3 simple habits that anyone can adopt that reduce the risk of a heart attack by more than 70%. I call these habits golden. Golden habit number 1, walk 30 minutes every day. You don't need to run or do intense exercise. A daily half-hour walk is enough. The key is consistency, not speed. I'll tell you the story of Mr. Adoy Costa, 82, who lives in Toluca, Mexico. For over 25 years, he's been getting up at 6 a.m. to walk in the park. It doesn't matter if it's cold or hot, he simply goes because his body needs it. His latest scan showed that his heart functions like that of someone 20 years younger. The secret: walking every day. Golden habit number 2, reduce your salt intake as much as possible. Salt is a silent enemy of the heart. It raises blood pressure, hardens arteries, and increases the risk of heart attacks. The worst part is that most people consume much more salt than necessary, especially through processed foods, cold cuts, instant soups, industrial breads, and canned food. Choose fruits, vegetables, legumes, and natural foods. Donna Joselina, 79, told me that it was difficult. At first she thought the food was bland, but after a month her taste buds changed. Now, she can't stand salty food. She feels thirsty and unwell, and her blood pressure has stabilized ever since. Golden habit number 3, stop smoking and drinking alcohol. No matter your age, I often hear, "Doctor, I'm 70 years old. Why stop now?" My answer is always the same: because it is still possible to improve your health. Mr. Carlos, 74, smoked for 50 years and decided to quit at 70. He thought it was too late, but in just 6 months he was breathing better, sleeping better, and could even climb stairs again without getting tired. It's never too late to change. Never. Your body will always thank you when you choose to take care of it. And if you're already taking medication for blood pressure, cholesterol, or diabetes, never stop taking it on your own. These medications protect your heart. If you think you no longer need them, talk to your doctor, but never take the risk alone. And please get a heart checkup at least once a year. Tests like an electrocardiogram, blood tests, and echocardiograms can detect problems before it's too late. Now, let's summarize together. I want you to keep this in your mind and heart. 5 warning signs of a heart attack: pressure or heaviness in the center of the chest, pain that radiates to the arm, neck, or jaw, fatigue without apparent cause, difficulty breathing and cold sweat, dizziness, nausea, or vomit. 8 steps to take if you are alone: sit in a safe place, chew an aspirin if you can, call emergency services and provide your address. Open the door and leave the key or code visible. Recline at a 45 angle with your legs slightly elevated. Send a short message to your family. Take a deep breath. Inhale for 4 seconds and exhale for 6 seconds. Press your wrists and cough 3 times. 3 golden habits to prevent heart attacks. Walk 30 minutes every day. Reduce salt intake. Stop smoking and drinking alcohol. But there's something else I want to ask of you. Write these steps down. Post them on the fridge, next to your bed, or somewhere you can see them every day. And if you can, practice them. Pretend you're having a heart attack. Look at the clock. Sit down. Breathe. Take action. It's not exaggeration. It's preparation. It's prevention. It's love for your own life. Now, do something for me. Go to the fridge, grab a piece of paper, and write, "I'm prepared. If I have a heart attack, I won't give up. I know what to do, and I'll survive." Read this phrase every day. Make it a promise to yourself, because you are not alone and deserve to live many years of health, joy, and peace. I'm Dr. Ana Laura. After 18 years of caring for thousands of hearts, I can say with conviction, you can beat a heart attack. And today, you took the first step. If this video helped you, share it. Send it to your parents, siblings, friends. Leave a comment saying, "I'm ready." This isn't just a comment. It's a promise to yourself and a true life statement. Take good care of yourself. I sincerely hope your heart is healthy and will accompany you for many, many years. Thanks for sticking with me until the end. See you in the next video.